Good morning, everyone. I'm Vidhi ANKLESARIA. I'll be presenting my paper titled Presentation and Surgical Outcomes of Epipulvar Dermolipomas, a 5-year data. So, epipulvar choristomas usually present in the temporal aspect of the ocular surface, and when they involve the cornea, they're usually inferotemporal in location. They grow during the first and second decade of life. They often present with keratinized epithelium with dermal appendages. And the indications for treatment are high astigmatism, encroachment on visual axis, ocular surface symptoms, and cosmetic concern. The purpose was to evaluate the growth management outcomes of epibulbar dermolipomas over a 5-year follow-up period. It's a retrospective review involving patients with epibulbar dermolipomas followed up for more than or equal to 5 years. These are the evaluated parameters at every visit. 61 eyes of 53 patients were included. The male to female ratio was 29 to 32. 8 patients had bilateral involvement. A syndromic association was seen in 27 patients. The most common syndrome was golden hour syndrome. This is a depiction of a patient with scalp syndrome. The ratio of operated to unoperated or observed eyes were 32 to 29 eyes with a mean follow-up of 6.7 plus minus 0.9 years. On excision on histopathology, 75% of the patients were dermolipomas, the rest were dermoids or complex choristomas. So patients who had corneal involvement underwent simple excision with lamellar keratoplasty and required an additional slit in case more than 6 clock hours of the limbus was involved. 8% patients required repeat surgery. 10% required eyelid reconstruction, and patients who had only conjunctival involvement underwent simple excision with conjunctival autograft or AMG. So this is a depiction of a patient who underwent the excision with an AMG pre and post-op. Operated eyes were 32. The mean size was 8.3 by 7.4. There was an improvement in the mean BCVA with a p-value of 0.05, reduction in the refractive errors in 81.25% of the patients with a p-value of 0.03, with 90.6% patients having a good cosmetic outcome. This is a patient who underwent excision with lamellar keratoplasty, and the post-op image is seen as underneath. There was also a reduction in the spherical equivalent in eyes with high astigmatism, which was considered more than -4 in this study, with a p-value of 0.03. This is a patient with golden hour syndrome having bilateral dermolipomas, which were excised, following which the patient had significant improvement in the spherical equivalent, and the patient also had high astigmatism. In unoperated or observed eyes, there were 29 in number. The mean size was 7.1 by 7.5. The BCVA improved by 2.1 with a p-value of 0.05. And in 13 eyes, the patients had amblyopia and they required occlusion therapy. They also had improvement in vision with a p-value of 0.04. The refractive error increased between the first and final follow-up in 45% of the eyes, but it was not significant. There was no change in lesion size in 79% of patients and thus opted for conservative management. But the patients, this is an image showing progressive follow-ups of conjunctival dermolipoma and a limbal corneal involving lesion over 6 years in the first patient and over 5 years in the second one. So in patients who had an increase in size, the mean increase over 10.6 years was 0.4 by 0.4. This is a patient who had increase in size of the lesion over a 6-year time period. To conclude, management of epibulbar dermolipomas involves observation when the patient is not symptomatic and does not want an excision, does not have amblyopia or high astigmatism. Surgical excision with appropriate grafting techniques like conjunctival autograft or an AMG in subconjunctival dermolipomas, and a lamellar keratoplasty when there is corneal involvement, along with slit when there is limbal involvement more than 6 clock hours. And occlusion therapy for amblyopia management is required in patients with conservative management as well as patients post-surgery. They often have associated myopic astigmatism that reduces post-surgery and requires serial follow-ups. Thank you.